Hello, I'm Trisha.
Mom,
Tony.
thank you, Tony. Mom, yours didn't work.
Sarah.
Thank you. All right, Dad and Charlene.
Terry.
Okay. Think about being in a situation where you cannot get out. You know your mental health is suffering and that you require professional assistance. But when you look for help, you either find that prices prohibit you or that your nearest mental health location is too far away from your home. It's not easy for you to reach. For many Americans, this is a poor reality that we live under. Okay, probably need somebody isn't muted. All right, thank you. All right. This issue matters to us all, especially as college students who are facing high levels of stress, anxiety, and depression. Studies show that among young adults are rising faster and faster having mental health issues, and this is from the World Health Organization back in 2022. Today, I will explain why access to mental health is still in an unequal in society. We'll explore three major barriers that keep people from getting the help: cost, location, and stigma. Millions of people don't get mental health because it's just too expensive. People who don't have insurance or enough money often can't afford to get mental health care. For instance, the National Alliance of Mental Health Illness says that people who don't have insurance are three times more likely to not get the mental health coverage or care that they need. The financial burden doesn't just affect people; it also affects where they live and the communities that they're in. For instance, when mental health care isn't available, productivity goes down, crime goes up, and healthcare costs also go up because people don't get the care that they need. Even if someone can afford the help, that doesn't mean that it's nearby. The next big problem is finding the care. Your location significantly influences your access to mental health care. There are a lot fewer mental health professionals and places to get help in rural and low income areas. For example, more than 75% of people living in low income areas who are in areas around the world are not getting mental health care at all. Technology can help fill this gap by creating new programs. For example, California telehealth programs made it easier for people to get care by 40% during the COVID 19 pandemic. I am not recording on my phone, so hopefully this is working. Okay, sorry. um, when shows which shows that remote care can reach people who don't have access to it. But even if care is cheap and easy to get, it might still be an invisible barrier: the stigma. Stigma is a misunderstanding that still stops people from getting the help that they need. A lot of people still think that mental illnesses is a sign of weakness rather than an actual health problem. For example, a study published in Lancelot found that the stigma is one of the best predictors of delayed treatment, especially among young adults. Stigma can change lives and communities for the better. For example, public education campaigns and open conversations about mental health, especially on college campuses and within schools, can help treatment become more normal and encourage early intervention. Unequal access to mental health care weakens our communities. By addressing these three barriers: cost, location, and stigma, we can create a society where help is available to all. When we work to create fair and equal mental health care policies or lend a helping hand to a friend in need, we still help move society towards a future where mental health care is universal, affordable, and totally free of judgment. If you remember nothing else from my speech, please remember this, that mental health care is not a luxury, it is a right. When one person gets the support they need, it prevents a chain reaction of suffering and instead builds a cycle of resilience and strengthens us all. Thank you. All right, I gotta stop recording.